It's Wednesday, March the 2nd. Unfortunately, we've had 73 deaths since the last time we were together, and I ask you again, please show all your respects and all the honor that we can pass on to these folks, as well as all their loved ones. Please do so. The 6,309th death is an 83-year-old male from Wetzel County. The 6,310th death, a 42-year-old male from Nicholas County. The 6,311th death, an 84-year-old male from Wood County. The 6,312th death, a 95-year-old male from Raleigh County. The 6,313th death, a 60-year-old male from Raleigh County. The 6,314th death, a 95-year-old female from Kanawha County. The 6,315th death, a 79-year-old female from Mingo County. The 6,316th death, an 81-year-old male from Wood County. The 6,317th death, a 62-year-old male from Kanawha County. The 6,318th death, a 63-year-old female from Marion County. The 6,319th death, a 43-year-old male from Raleigh County. The 6,320th death, an 89-year-old female from Ohio County. The 6,321st death, a 75-year-old male from Roane County. The 6,322nd death, a 62-year-old male from Harrison County. The 6,323rd death, an 81-year-old female from Kanawha County. The 6,324th death, a 48-year-old female from Fayette County. The 6,325th death, an 86-year-old female from Kanawha County. The 6,326th death, an 80-year-old female from Kanawha County. The 6,327th death, a 97-year-old female from Kanawha County. The 6,328th death, a 59-year-old female from Kanawha County. The 6,329th death, a 78-year-old female from Hancock County. The 6,330th death is a 96-year-old female from Raleigh County. The 6,331st death is a 67-year-old male from Berkeley County. The 6,332nd death, a 52-year-old female from Berkeley County. The 6,333rd death is a 33-year-old male from Wood County. The 6,334th death is a 73-year-old female from Fayette County. The 6,335th death is a 79-year-old female from Hancock County. The 6,336th death is a 60-year-old male from Upshur County. The 6,337th death is a 51-year-old female from Randolph County. The 6,338th death, a 48-year-old female from Putnam County. The 6,339th death, an 81-year-old female from Mingo County. The 6,340th death, a 68-year-old female from Ohio County. The 6,341st death is an 83-year-old male from Mercer County. The 6,342nd death is a 75-year-old female from Taylor County. The 6,343rd death is a 57-year-old female from Kanawha County. The 6,344th death is a 51-year-old male from Cabell County. The 6,345th death is a 79-year-old male from Monongahela County. The 6,346th death is a 67-year-old female from Kanawha County. The 6,347th death is a 79-year-old male from Berkeley County. The 6,348th death is an 86-year-old female from Wood County. The 6,349th death is a 79-year-old female from Harrison County. The 6,350th death is a 65-year-old male from Wood County. The 6,351st death is a 92-year-old female from Grant County. The 6,352nd death is a 79-year-old female from Kanawha County. The 6,353rd death is an 81-year-old male from Greenbrier County. The 6,354th death is a 62-year-old male from Fayette County. The 6,355th death is a 58-year-old male from Ohio County. The 6,356th death is a 92-year-old female from Wood County. The 6,357th death is an 82-year-old female from Braxton County. The 6,358th death is an 80-year-old female from Wyoming County. The 6,359th death is a 74-year-old female from Wyoming County. The 6,360th death is a 72-year-old female from Wyoming County. The 6,361st death is a 73-year-old female from Fayette County. The 6,362nd death is an 85-year-old female from Wyoming County. The 6,363rd death is a 79-year-old female from Berkeley County. The 6,364th death is an 81-year-old female from Raleigh County. The 6,365th death is a 93-year-old female from Preston County. The 6,366th death is a 60-year-old male from Wood County. The 6,367th death is a 45-year-old male from Monroe County. The 6,368th death is a 60-year-old female from Mineral County. The 6,369th death is a 63-year-old male from Greenbrier County. The 6,370th death is a 68-year-old male from Tyler County. The 6,371st death is a 94-year-old female from Summers County. The 6,372nd death is a 40-year-old male from Calhoun County. The 6,373rd death is a 71-year-old female from Harrison County. The 6,374th death is an 81-year-old male from Marion County. The 6,375th death is a 67-year-old male from Hancock. The 6,375th death is a 67-year-old male from Kanawha County. The 6,376th death is a 95-year-old female from Hancock County. The 6,377th death is a 93-year-old female from Pendleton County. The 6,378th death is an 85-year-old female from Cabell County. The 6,379th death is a 100-year-old female from Mercer County. The 6,380th death is an 86-year-old female from Raleigh County. And the 6,381st death is a 91-year-old male from Logan County. Oh, my. Some good stuff is we're down to 2,143 active cases in West Virginia, and that's the lowest that it's been since July the 29th, 2021. So that's really good, or surely way better. We have 498 new positive cases. You remember, not long ago we were having 4,000. Our daily positivity rate is at 5.49. That's a lot better. Our cumulative is still at 8.39. We have 482,000 plus people that have recovered and 481 people now that are hospitalized. Down in the 400s, that's a big improvement. We have 124 in the ICU units and 64 on ventilators. And every county in the state of West Virginia is now green, with the exception of 5 counties. Well, it's been a long time coming, hasn't it? But I'm going to leave that just a second. I want everybody to see it, for this point in time. And you don't want to drop our guard completely by any stretch, but we're really, really getting out of this. And the sun is starting to really shine, and spring is coming, and I wouldn't completely drop my guard by any stretch, but it'd be really nice to start seeing the robins now, wouldn't it? CDC has now loosened their mask requirement, and you've seen that from the State of the State last night and on, and that's good. I want to thank our National Guard over and over for all the great work that they've done in backstopping and helping our hospitals and all the stuff they do all the time. But today I'm announcing that on March the 11th, we will complete this mission. And we congratulate and thank them in every way. The home tests where you can get 4 free home tests are available. You got to go to our COVID-test.gov. I think, President Biden even announced last night that there's going to be more home tests, that if you need them, that they're going to get more out to people. From the standpoint of the N95 mask, which praise the Lord, we don't have to wear right now the way it looks and everything, unless you've got all kinds of compromising issues or you're elderly and everything, you can get them at the pharmacies or the community health centers, and so take advantage, while you can and while they have them available. I remind you about giving blood. Absolutely, you should consult with your physician, and if all's good and everything, please consider that. I remind you over and over about your booster shot. It is still really, really important for you to get that booster shot. Really important. Our numbers continue to improve just little by little, but it's been slow. We know it's been slow, but it's been, slow is better than nothing. I'll promise you that we've gotten a bunch of people across the finish line, and the net of that is we've probably saved a bunch of lives there. All the COVID information's up on my website. You can take advantage of all the free testing. We always want to thank Frith and Walgreens for what they did in the beginning days and still are doing. We got 136 outbreaks in our long-term care facilities. That's dropped from, I think, 159. We have no outbreaks in our church community. We're down to 106 inmate cases, 23 staff cases. So corrections is really on their game. They're doing really great work there. We still have the money available on this rental assistance program that's available for landlords and renters. You need to call us and see if we can get you qualified. The Jumpstart program that incentivizes people to get back into the workforce, even though we have historic lows as far as our unemployment numbers. We're offering $1,500 to those people if they can get a job and get back in the workforce. We need you and be at that job for at least 8 weeks. We still continue to offer up our prayers, and even in a bigger way, to all the people of Ukraine. We've got a terrible situation there with President Putin. That what he's doing is just outrageous beyond belief. The world's really not seen anything like this. To where just bombing targets of innocent civilians in every way, and not military targets, and just it's a shame. It's really a shame. And we just issued a ban on Russian liquor. I don't know that it's anything significant in any way, but it was just maybe a gesture to show the Iranian people that we're with them, and so I did an executive order and on that on Monday. The state of the state was last night and everything, and I listened very closely, and to be perfectly honest, I'd tell people that just to tell you the truth, the delivery from President Biden, I thought really he probably did a pretty decent job in the delivery. The substance was not very good. It had many discrepancies in the substance, in my opinion, but to be perfectly honest, I've seen President Biden when it looked like he was really struggling to talk, and in some way, somehow, he got through it, and the delivery was good. And like it or not like it, we should always be respectful. He is our president, and I want to always be respectful to the presidency of the United States. I think he's doing a horrible job, but with all that, we should be respectful. Now, let me just say just this. From the standpoint of this nation's potential to be completely energy dependent, as we surely were, or on our way of being exactly that under President Trump, without any question, why does this country need to be dependent on energy? Energy is absolutely, and I've said it over and over and over, if you'll go back through all the civilizations of time, absolutely civilization only progresses with cheap, abundant energy. That's all there is to it. At the end of the day, energy drives the day. So with all of that, how in the world could we expose ourselves expose ourselves. And really, and at this point in time, if President Biden last night would have just said to the people, I've thought a lot about it, and I really, really want us to have pristine environment, pristine waters and everything. And I want us to try to some way, somehow, slow down this thing that he believes in global warming. I really believe is anybody able to convince me beyond a doubt that there is global warming or not global warming? I don't know. But I can tell you that scientifically, it has not been proven to me. Now, with all that being said, here's the bottom line, and what I think the President of the United States should say is, first, we're going to take this step by step. We're going to pray to God above that if there is such a thing as global warming, which I don't think there really is, but if there is such a thing as that, we're going to pray to God above that some way, somehow, he'll make sure that this earth takes care of itself or some way is able to put up with us for a little bit longer. But first and foremost, we in this nation, the nation that is the shining spot of the entire world, absolutely the nation that truly, truly is the babysitter and looks after the whole world, the example for the whole world. This nation's got to be energy independent. And it is absolutely got to be that. And so with all that, I would say if President Biden would have come out and said, look, I really wanted to go another way, but considering what's on the table and I've looked at this, we're going to open this thing up. And we're going to build Keystone. We're going to absolutely build our pipelines here. We're going to open up drilling. We're going to move in that way. You would have stopped this war. You would have stopped it right in its tracks. You would have stopped this invasion into this country right in its tracks. Because we couldn't have changed that overnight, but the Russians would know that it's coming. And so I really and truly, at the end of the day, this thing in Ukraine can escalate into something really, really, really bad. And we don't need that. We just don't need that. We had a terrible fire at our deaf and blind school, and, it was heartbreaking beyond belief. I was in immediate contact with all the folks from the fire marshals to my chief of staff to, Superintendent Birch and all the education folks and everything. And my words to them were just this. The psychological trauma, thank God the students weren't on campus, and thank God, this building was not being used for students at that time and everything. But the psychological impact of something like this is really tough. Now, everybody's on it and everybody's still investigating it and trying to figure out what to do. And I can tell all those, that we're surely not going to walk away. We're absolutely going to rebuild. To the folks in the town of Romney and in that area, this is a very, very important school, and surely to all the students and all faculty and everything, you just got to know we're with you, and we'll get through it. We'll get through it. But the impact, the psychological impact on all is difficult, and we recognize that, and that was my point to Clayton Birch, and we're going to stay right with you and be right on it. The revenue numbers, I don't know if we announced this and everything the other day, but I guess not. The net of the whole thing is, and I would just say just as simple as this, it's hard to get really tired of winning. I mean, that's all there is to it. And now we have, surpluses that are totally beyond belief. we're standing at year-to-date surpluses of $589.9 million above, our estimates. We're at 59.2 million on surplus for the month, excuse me, for the month of February. And it's a short month. It is truly unbelievable, what we have done and how we've changed the map, how we've changed West Virginia from being that place that everybody looked down on to a place that absolutely people are thinking, great time of day. What is going on in West Virginia? They truly are that diamond that we missed and everything. And absolutely, we said in the beginning, we're going to take you on a rocket ship ride. And my gracious sakes of living, we're on a real rocket ship ride. And we've got so many opportunities to do so much more good as we go forward. We're going to continue to do that. We're not going to stop until we've flipped every single rock. And I guess we did announce this yesterday or put it out yesterday, but my goodness, how good is good? And at the end of the day, you just keep on winning, and it's hard to get tired of winning. So that's what we're going to continue to try to do. Unemployment numbers, same kind of thing. They just keep, they adjusted on a national basis. They adjusted the unemployment numbers just a little bit and everything, but we still just have record after record after record. I think it's now 22 consecutive months that we've decreased, our seasonally adjusted unemployment rate. That's really good. Last month, there was 1,700 people that we decreased on our unemployment numbers and grew by 2,700 that got back into the workforce and into employment. It's just been one record right after another, and we're really proud of all the folks that are putting in a lot of licks and everything to make all this happen in every way. Just a couple of things real quick. Yesterday I released a video reading to all West Virginia schools in celebration of the upcoming Read Across America Day. I chose a book that says Take Me Home Country Roads. It really and truly, to me, it was a real reflection of who we are. The words, if you really, really, really dive into the words, you'll really get a tremendous meaning from the song. John Denver, I guess, wrote the song and Shirley sang the song, and it was a real gift to West Virginia. Now everybody all across the world knows that song and everything, and we lost him tragically way, way, way too young. But Kathy also read a book, our First Lady read a book entitled Love is All Around West Virginia, but nevertheless, it's good stuff, and I hope that our kids got to see that. We're going to award AML grants here in just a little bit at 12:30 today, and this is Abandoned Minelands grants, and I encourage you to tune in on that, and that's all I've got, and thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor has effectively shared with us, we are seeing many positive signs when it comes to the reduction of the current surge that we are experiencing. We are, however, both in the country and in West Virginia, continuing to see deaths that are increased from our baseline. And certainly we know the importance of full vaccination and boosting. That is being seen now in every study being done, particularly related to the Omicron variant of COVID-19. It's also important to recognize that more and more we're starting to understand the impact of the long COVID complications. In a study from the United Kingdom, 1 out of 7 children who had COVID-19 are experiencing some form of long COVID. And as we look at the impact on our heart system, on our brain and our nervous system, we see that there is a up to 73% increase at 1 year in cardiovascular and heart problems, including heart failure and stroke. And as we look at our brain, people with brain fog is an increasingly important complaint that people have from developing COVID-19. And people can get long COVID symptoms, even with a very mild case of COVID-19. But the more severe the case and the more severe the symptoms, the higher the risk of suffering long COVID symptoms. And that range can be up as high as 40 to 60% of people that have been hospitalized that may experience some consequences of long COVID. It's also important to recognize that full vaccination and boosting seems to reduce the risk of long COVID by about 50%. So another reason to be fully vaccinated and boosted. Lastly, a big study from the American Red Cross that looked at antibody testing and blood that's been taken demonstrates, and the CDC demonstrates that about twice as many people in the US as we've documented appear to have had exposure and experience from COVID-19. They have immune function that demonstrates that they have been either infected or challenged with COVID-19. And that's important not only because as we look at the age ranges, 60% of our under 18-year-old population has evidence of having COVID-19. As we look at our over 65-year-old population, that goes down to only 23%. But it means that about half of our population have likely either been infected or challenged with COVID-19. And along with the vaccinations, that gives us probably the most immune function that we've seen thus far in the pandemic. So while we continue to watch carefully if the virus mutates more and new variants come up, we're not really seeing that right at this very moment, but we have learned enough to know to respect this virus and not to believe we can predict what the virus is going to do. But it makes it really important for all of us to continue to enhance our immune function, because that's the best way that we can protect ourselves, protect each other, and reduce the risk of the virus from mutating to another variant. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just a couple of items to follow up. As the governor pointed out, we are trending significantly in the right direction. Our RT value now at 0.8, as the governor pointed out, hospitalization numbers overall down below 500 the first time in a long time, down to 481. We do have ample supply available now of the appropriate antibodies available, as well as the antivirals. We are now seeing a decrease in requests from facilities for those items. So that is another good trending number. But as Dr. Marsh pointed out, our booster numbers, particularly among age 50 and above, particularly 65 and above, need to continue to increase significantly. As the governor showed us today, a significant number of West Virginians, particularly older West Virginians, are still succumbing to the virus. And just a point of reference, we had projected that sometime between the 1st and the 15th of March that we would hit 6,400 deaths related to this virus, and we are 19 away from being 100 times greater than what was initially projected in 64 deaths. And that's only on the 2nd of March. So we've got to continue to get those West Virginians the booster doses, and those who have had COVID taking a first dose of the vaccine and getting in that process shows significant improvement in levels as well. Thank you.
All right, thank you, sir. Dr. Ayn Amjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to clarify, Governor, you said that the National Guard's mission in the hospital will end on the 11th. Is that correct? And then I wanted to ask about what is next for the National Guard now that this phase is closing. Where will we reallocate those folks, and what is the National Guard doing response-wise day to day at this point?
Well, first of all, Charles, the date's right on March the 11th, and General Crane can be with us and be on Monday. But listen, Charles, you know, it just, there's a duty for these great people. It seems like nonstop. And what they do is unbelievable, and we're really, really, really proud of them. And so I'm sure there'll be plenty of tasks and everything, but General Crane can come on Monday and answer that better than I.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
I have a question for Dr. Marsh. Doctor, without engaging in any predictive or projective behavior, what numbers will you need to see in order for you to think, as a physician, as the person who's been leading this charge, that we have moved from what people would generally consider a pandemic to whatever the next lesser phase of this thing is going to be? Thank you.
Doc, please.
Thank you, Governor, and thank you, Kenny. You know, Kenny, I think that we are actively moving in that direction currently. And obviously, we can't predict the future, and we need to monitor the virus very carefully, because the virus has really been dictating our response, not the other way around. But given the levels of immunity that we have today, the increasing, although albeit much slower, continued vaccination of our population, and the acceptance of living with the consequences of COVID-19, all are critical factors in seeing that movement. And as General Hoyer mentioned, the governor as well, we are seeing our hospital numbers go down. Remember, our nadir, our low number, was about 52 people in hospital beds in July of 2021. So we're still a piece away from that, but we're below 500 people in West Virginia hospitals with COVID-19 for the first time before the Delta peak. So that is all encouraging. And as we follow national trends, we are seeing cases reduce, number of people going into hospitals reduce, and total number of people in hospitals reduce. And those are all the same metrics CDC is monitoring, and we are too. So if the virus doesn't make a left turn and mutate more and become another variant that we haven't, aren't ready for immunologically, then I think we are well on our way toward that direction right now. Thank you.
All right, thank you, Kenny. Next to Jess Mancini with Ogden Newspapers.
Hi, thank you for taking my question. The state drug control policy, the Office of Drug Control Policy, said that overdose deaths were trending downward. And my question is there a correlation between overdose deaths going down with the decrease in the number of active cases of the virus? Thank you.
Secretary Krause, why don't you try this, please, sir?
There's a clear correlation with regard to this pandemic and the isolation and the inability to access support services for folks who have SUD. This is a serious issue. The governor has pushed very hard to keep our efforts going and to, in fact, increase efforts with regard to this problem. His Governor's Council on Substance Disorder has made some great strides. Our Office of our Bureau of Behavioral Health Services has done great work with regard to increasing the number of quick response teams out there. Our Office of Drug Control Policy with Dr. Matt Christensen has really pushed hard over the past year to really implement new programs and new contacts out there and new resources. We have a huge increase of recovery programs in the state. In 2017, our numbers were going up. We were #1 in the country with regard to overdose deaths. In 2018, with the efforts we were going forward with, we had a 22% reduction in overdose deaths. In 2019, we had a 13% reduction in overdose deaths. And then this pandemic hit, and we ended up with a lot of folks who lost those contacts, lost those resources, lost a lot of the support mechanisms they needed to tackle this. Legislature jumped in 2017 with the Ryan Brown Fund, and we increased treatment beds. We're now back on track. So we are showing decreases from April through this month in overdose deaths. Those numbers look terrific. We're cautiously optimistic that this pandemic is behind us, and that we can again push out more programs and try to get this disease under control. That's the disease that's been going on in the background while the pandemic's going on. So we're working hard. Again, the governor's pushing hard. We're going to have more impact on this program as we go forward.
All right, thank you, Jess. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everybody. Governor, I want to circle back to Hyperloop. We have the players in place to answer the question, I think, today. Usually when you make an economic development deal as large as Hyperloop, you have some incentives involved in that package. What sort of incentives did Virgin get to come to West Virginia? Did the scaling back or change in the project affect that agreement any? And are they in breach, or are you going back to the table with them to ensure that West Virginia incentives are used in the proper way in this situation? Thank you.
Paul, thanks a bunch. In general, now this is yours. We got you back here today, and tell us all kinds of good stuff.
Yes, sir, Governor. So, Paul, first, and I'd mentioned this on a show the other day, is we need to understand that we attracted the equivalent of a large scale venture entity or small entrepreneur entity. So we had to treat them as such. So from a state perspective, we did not give a startup an incentive that we would then lose. So everything that was promised to Hyperloop was related to performance related activities on their end. So when Hyperloop provides a certain number of jobs and investment in the state of West Virginia, they would then get an investment from the state itself. So we are out the time and effort so far of attracting a large scale startup. We still believe that Hyperloop and the concept of Hyperloop transportation is something that we, the state of West Virginia, should continue to be aggressive in going after, and thus the Department of Transportation and partners within the state have put in a grant for Next Generation Transportation Center. But at this time, the state of West Virginia has not invested any money that it needs to recall from Virgin Hyperloop, that particular Hyperloop company.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, that came back to me real quick, didn't it? I really, I don't really have anything to add. I think General Hoyer covered the Hyperloop question well, and I appreciate those folks coming on and asking the questions. And I guess what we do is we just stay at it. I ask for your prayers, a whole bunch, for 73 additional West Virginians that we lost. And all their loved ones. But that's all I got. Thank you.